For years, right? We've been hearing about the promise of AI in medicine. Well, guess what? That promise isn't a promise anymore. The practice has begun. Today, we are going to dive into the evidence that shows AI has hit this massive tipping point in healthcare, moving straight out of the lab and right into the clinic.
And this quote, it just nails it. It really frames everything we're about to talk about. AI is no longer some futuristic what if. It's a what's happening right now. And you'll see, this isn't some slow, gradual change. It is a decisive shift, and the evidence is just piling up.
So all the incredible insights we're covering today, they come from a really fascinating analysis by Dr. El Mostafa Bouattain. And what I think is so cool about this is the perspective. It's written from the future, from September 2025, which gives us this kind of time capsule view of the exact moment this whole revolution really took hold.
Okay, so what does this revolution actually look like on the ground, in the hospital? Let's kick things off with the brand new tools that doctors are starting to use every single day.
And this is a big one. Epic, and if you know healthcare tech, you know they are a giant in electronic health records. They launched a platform called Comet. And look, this isn't just another piece of software. People are calling it one of the most significant AI advancements in clinical practice, well, ever.
The sheer scale of Comet is what's truly mind-blowing. It's built from over 100 billion, with a B, patient medical events. Think about that data. And it doesn't just give you one answer. It actually generates multiple possible future timelines for a patient. It can predict disease risk, guess how long someone might be in the hospital, and get this, in tests, it actually beat other AI models that were designed for just one specific task. That is a total game changer.
And this kind of thing isn't just happening in a bubble. Look at the McGill University Health Center. They have an ambient AI system that uses 3D sensors just to make sure staff are washing their hands correctly, which is a huge deal for patient safety. At the same time, over at Toronto's Sick Kids Hospital, machine learning is speeding up diagnoses for things like appendicitis by hours, just using the data they get at triage. So you have two totally different problems, both being solved by AI right now.
Now, beyond just diagnostics, there's another tool that is changing the day-to-day life of a doctor so profoundly that it's actually breaking records.
So I want you to think about this for a second. Healthcare is, notoriously slow to adopt new tech. So what on earth could be moving this fast?
Ambient AI scribing, that's the answer. These are tools that literally just listen to a conversation between a doctor and a patient and automatically write up all the clinical notes. In an industry that usually measures change in years, this tech is being adopted at a speed nobody has ever seen before. Let's look at the impact.
2. Just look at this number. This is the number of hours some doctors are saving every single day on paperwork. That's 2 hours of their life back.
And how about this one? 50%. That is the reduction in the administrative burden they're reporting. And this isn't just a nice-to-have, a convenience. It is a direct attack on physician burnout, which is one of the biggest crises in modern medicine.
And this might be the most crucial point of all. A pilot study out of Vanderbilt found that doctors using this tech were actually less likely to quit their jobs. So AI isn't just making work more efficient, it's literally helping keep doctors in the profession. That's huge.
Okay, so we've got these incredible new tools. But for a revolution to be real, it can't just be about the tools. The entire system has to adapt. And that is exactly what we're seeing when it comes to regulation and investment.
I mean, just look at how fast the regulators are moving. In 2024, there were about 950 FDA-approved AI medical devices. By July of 2025, so just about a year later, that number shot up to 1,250. That's a 31% increase. The floodgates are definitely opening.
And we can see exactly where the adoption is hottest. No surprise, radiology, which is all about interpreting images, is the clear leader with nearly 1,000 approved devices. Cardiology is a distant second, but it's still strong. This just shows a maturing, specialized market taking shape.
You know what they say, follow the money. And the money is following this trend. In just the first half of 2025, a massive 62% of all digital health funding in the US went to AI companies. For the very first time, AI is capturing the majority of the investment. So what does that 62% look like in actual dollars? $4 billion. That's how much cash was poured into AI health companies in just 6 months. The market isn't just confident here, it's going all in.
All right, so let's pull all of these different threads together. We've seen the incredible tools, The crazy fast adoption, the supportive regulation, and the massive investment. The evidence is just crystal clear. This is no longer a promise, it's practice.
Here's the final proof, all in one place. Let's talk scale. 63% of healthcare organizations are now actively using AI. Integration. AI scribes are handling almost a third of all outpatient documentation around the world. Regulation. We've got over 1,200 AI-enabled devices with the FDA's stamp of approval. And investment? AI is pulling in the lion's share of all new funding. This isn't hype anymore, folks. This is a mature, operational, new standard of care.
And all of this, it brings us to the real question, the one we're all left with. If the machines get better and better at analyzing data, at handling all the paperwork, at predicting what's going to happen, what does that free up us humans to do? What becomes the new core of compassionate human-to-human healthcare?
You know, this is really just scratching the surface, and it's all based on the amazing analysis of Dr. El-Mostafa Bouaten. If you want to go deeper on this, and trust me, you do, I highly recommend his book. It's called Healthcare's AI Revolution, a practical guide for clinicians, executives, and patients transforming medicine through human-AI collaboration. It's available right now on Amazon, and it is the perfect next step for anyone who is fascinated by this topic.